continue with the head. We are on the chapter 7, letter C, lower capital C. And we are continuing, right, as we were saying that the roots inferiorly along the line of attachment of the cerebral pulse to the cerebellar tentorium, where it joins the confluence of sinuses. And then we pass to the transverse sinuses, and where we say that pass laterally from the confluence of sinuses growing the occipital bones and the posterior inferior angles of the parietal bones. The transverse sinuses course along the posterolateral attachment margins of the cerebellar tentorium, and then becomes the sigmoid sinuses as they approach the posterior aspect of the petrous temporal bones. Blood received by the confluence of sinuses is drained by the transverse sinuses, but rarely equally. Usually the left sinus is dominant, which means larger. The sigmoid sinuses follow L-shaped courses in the posterior cranial fossa, forming deep grooves in the temporal and occipital bones. Each sigmoid sinus turns anteriorly and then continues inferiorly as the IG5 after traversing the jugular foramen. The occipital sinus lies in the attached border of the cerebellar pulse. The end superiorly in the confluence of sinuses. The occipital sinus communicates inferiorly with the internal vertebral venous plexus. The cavernous sinus or lateral sellar compartment is situated bilaterally in each side of the sella turcica, on the upper surface of the body of the hollow sphenoid bone, which contains the sphenoidal air, which is the sinus. Each sellar compartment contains a cavernous sinus consisting of a venous plexus of extremely thin wall vein and extends from the superior orbital fissure anteriorly to the apex of the petrous part of the temporal bone posteriorly. Receives blood from the superior and inferior ophthalmic vein, superficial middle cerebral vein, and sphenoparietal sinus. The venous channels in these sinuses communicate with each other through venous channels anterior and posterior to the stalk pituitary gland, the intercavernous sinuses. Take a look in your atlas, the superior view of this book, right? We're saying that the intercavernous sinuses, right, and sometimes through vein inferior to the pituitary gland. The cavernous sinuses drain posterior inferiorly to the superior and inferior petrosal sinuses. And emissary vein to the pterygoid plexuses, right? And inside each sinus or compartment is the internal carotid artery with its small branches, surrounded by the carotid plexus or sympathetic nerve and the abducent nerve. From superior to inferior, the lateral wall of the cavernous sinus incorporates the oculomotor nerve, the trochlear nerve, the trigeminal nerve. These cranial nerves are sheathed in the lateral wall of the sinus. The superior petrosal sinuses run from the posterior ends of the vein comprising the cavernous sinus to the transverse sinuses at the site where these sinuses curve inferiorly to the sigmoid sinuses. Each superior petrosal sinus lies in the anterolateral attached margin of the cerebellar tentorium, which attaches to the superior border of the petrous part of the temporal bone. The inferior petrosal sinuses also commence at the posterior end of the cavernous sinus inferiorly. Each inferior petrosal sinus runs in a groove between the petrous part of the temporal bone on the basilar part of the occipital bone. The inferior petrosal sinus drains the vein of the lateral venous sinus directly into the origins of the IG5. The basilar plexus, the sinus connects the inferior petrosal sinuses and communicates inferiorly with the internal vertebral plexus. Emissary veins connect the venous sinuses with the veins outside the cranium. Although they are valveless and blood might flow in both directions, flow in the emissary vein is usually away from the brain. The size and number of emissary veins vary. A frontal emissary vein is present in children and some adults. It passes through the foramen secum of the skull, connecting the superior sagittal sinus with veins of the frontal sinus and nasal cavities. A parietal emissary vein, which might be paired bilaterally, passes throughout the parietal foramen in the calvaria, connecting the superior sagittal sinus with the vein external to it, particularly those in the scalp. A mastoid emissary vein passes through the mastoid foramen and connects each sigmoid sinus with the occipital or posterior auricular vein. A posterior condylar emissary vein might also be present and pass through the condylar canal, connecting the thymus sinus with the suboccipital plexus of veins. The vasculature of the dura mater, the arteries of the dura, supply more blood to the calvaria than the dura. The largest of the meningeal arteries, the middle meningeal artery, is a branch of the maxillary artery. It enters the floor of the middle cranial fossa through the foramen spinosum, runs laterally in the fossa, and turns anteriorly on the greater rim of the sphenoid, where it divides into anterior and posterior branches. The anterior branch of the middle meningeal artery runs superiorly to the pterion and then curves posteriorly to ascend towards the vertex of the skull. A blow to the side of the head might fracture the bones forming the pterion and rupture branches of the middle meningeal artery. The posterior branch of the middle meningeal artery runs postero-superiorly and ramifies over the posterior aspect of the skull. Small areas of dura are supplied by other arteries, meningeal branches of the ophthalmic arteries, branches of the occipital arteries, and small branches of the vertebral arteries. The vein of the dura accompany the meningeal arteries often in pairs and might also be torn in fractures of the calvaria. The middle meningeal vein accompanies the middle meningeal artery, leaves the cranial cavity through the foramen spinosum or foramen ovale, and drains into the pterygoid plexus. Nerve supply of the dura mater. The nerve supply of the dura mater of the anterior and middle cranial fossa dura is largely from branches of the trigeminal nerve. The anterior meningeal branches of the ethmoidal nerves and the meningeal branches of the maxillary and mandibular nerves supply the dura of the anterior cranial fossa. The dura of the middle cranial fossa is supplied mainly by branches of CN5 and CN5, the 3 and 2. The dura of the posterior cranial fossa is supplied by the tentorial nerve, a branch of the ophthalmic nerve, and by sensory branches from dorsal roots of C1 through C3 nerves, and might receive some innervation from the vagus nerve, CN10. Sensory endings are more numerous in the dura along each side of the superior sagittal sinus and in the cerebellar tensorium that they are in the floor of the cranium. Vein fibers are numerous, whereas arteries and veins course in the dura. The pia arachnoid, combined pia matter and arachnoid matter, develops from a single layer of mesenchyme surrounding the embryonic brain. Even in the adult, the arachnoid and pia are actually the visceral and parietal parts of the same layer, the leptomeninges. Fluid fills spaces from within this layer and coalesce to form the subarachnoid space. The derivation of the pia arachnoid from a single embryonic layer is evident in adults by the numerous web-like arachnoid trabeculae passing between the arachnoid and pia. which give the arachnoid its name. The trabeculae are paths of flattened, irregular-shaped fibroblasts that bridges the subarachnoid space. The pia and arachnoid are in continuity immediately proximal to the nerve exit from the germ matter. The arachnoid matter contains fibroblasts, collagen fibers, and some elastic fibers. Although thin and arachnoid is thin enough to be manipulated with forceps, the avascular arachnoid closely applied to the meningeal layer of the dura is not attached to the dura. It is held against the inner surface of the dura by the pressure of the CSF. The pia mater is an even thinner membrane that is highly vascularized by a network of fine blood vessels. The pia is difficult to see, but it gives the surface of the brain a shiny appearance. The pia adheres to the surface of the brain and follows all its contours. When the cerebral arteries penetrates the cerebral cortex, the pia follows them for a short distance, forming a pial coat and a periarterial space. Meningeal spaces. Three meningeal spaces are related to the cranial meninges. The dura-skull interface, which is called the extradural or epidural space, is normally not an actual space but only a potential one between the cranial bones and the external periosteal layer of the dura. Because the dura is attached to the bones, it becomes a real space only pathologically. For example, when blood from torn meningeal vessels pushes the periosteum from the skull and accumulates. The dura-arachnoid junction or interface, which is known as subdural space, is like normally a potential space that might develop in dural border cell layer of the dura after a blow to the head. The subarachnoid space between the arachnoid and pia is the actual space that contains CSF, trabecular cells, arteries, and veins. Although it is commonly stated that the brain floats in CSF, the brain is suspended in the CSF-filled subarachnoid space by the arachnoid trabeculae. The brain, composed of the cerebellum, and brainstem, midbrain, pons, and medulla oblongata, is lodged in the cranial cavity. The space within the skull occupied by the brain, meninges, and CSF. The roof of the cranial cavity is formed by the calvaria, and its floor is formed by the cranial base. The following brief discussion of the gross structure of the brain shows how the brain relates to the cranium, cranial nerves, meninges, and CSF. The parts of the brain when the calvaria and dura are removed with gyri, sulci, and fissures of cerebral cortex are visible throughout the delicate pia arachnoid layer. The fissures and sulci of the brain are distinctive landmarks that subdivide the cerebral hemispheres into smaller areas. The cerebrum, the principal part of the brain, includes the cerebral hemisphere and the encephalon, but not the brainstem, which is the medulla, pons, and midbrain. The cerebral hemispheres form the largest part of the brain, occupying the anterior and middle cranial fossa uh, and extending posteriorly over the cerebellar tentorium and cerebellum. The cavity in each cerebral hemisphere, a lateral ventricle, is part of the ventricular system of the brain. The encephalon, composed of the epithalamus, dorsal thalamus, and hypothalamus, forms the central core of the brain and surrounds the third ventricle. The cavity between the right and left half of the encephalon forms this narrow ventricle. The midbrain, the rostral part of the brainstem, lies at the junction of the middle and posterior cranial fossae. The cavity of the midbrain forms a narrow canal, the cerebral aqueduct, that conducts CSF from the lateral and third ventricle of the fourth ventricle. The pons, the part of the brainstem between the midbrain rostrally and the medulla oblongata caudally, lies in the anterior part of the posterior cranial fossa. The cavity in the pons forms the superior part of the foreventricle. The medulla oblongata is the most caudal subdivision of the brainstem that is continuous with the spinal cord, and it lies in the posterior cranial fossa. The cavity of the medulla forms the inferior part of the foreventricle. The cerebellum, the large brain mass lying dorsal to the pons, and medulla and ventral to the posterior part of the cerebellum, lies beneath the cerebellar tentorium in the posterior cranial fossa. It consists of two lateral hemispheres united by a narrow middle part, which is known as the permis. 11 or 12 cranial nerves arise from the brain. They all exit the cranial cavity. They have motor, parasympathetic, and or sensorial functions. Generally, these nerves are surrounded by a dural sheath. As they leave the cranium, the dural sheath becomes a continuous with the connective tissue of the epineurium. Right. The ventricular system of the brain consists of two lateral ventricles and the midline third and fourth ventricle connected by the cerebral aqueduct, largely secreted by the choroid plexus of the ventricles, fills this cavity and the subarachnoid spaces of the brain and spinal cord. The ventricle, the choroid plexus, and the CSF produced by the plexus are essential elements in the normal function of the brain. The ventricles of the brain. The lateral ventricles, the first and second ventricles, are the largest cavities of the ventricular system and occupy large areas of the cerebral hemispheres. Each lateral ventricle opens through an interventricular foramen into the third ventricle. The third ventricle, a slit-like cavity between the right and left halves of the diencephalon, is continuous posteriorly with the cerebral aqueduct of midbrain, and narrow channel in the midbrain connecting the third and fourth ventricles. The fourth ventricle in the posterior part of the pons and medulla extends inferior-posteriorly. It is continuous throughout the central canal in the inferior part of the medulla with the central canal in the spinal cord. CSF drains from the foreventricle through a single median aperture and paired lateral apertures into the subarachnoid space. These apertures are the only means by which CSF enters the subarachnoid space. If they are blocked, CSF accumulates and the ventricles distend, producing compression of the cerebral hemispheres. The subarachnoid cisterns. In certain places, primarily at the base of the brain, the arachnoid and pia are widely separated by subarachnoid cisterns. The large pools of CSF contains arteries, veins, and the roots of cranial nerves in some cases. These chiasmatic cisterns contain the optic chiasm and the roots of the optic nerves, CN2. The cisterns are usually named according to the structure related to them. Posterior, the cerebellomedullary cistern. The largest of the subarachnoid cistern is between the cerebellum and the medulla and receives CSF from the apertures of the foreventricle. The pontine cisterns. Prepontine cistern is also called an extensive space ventral to the pons, is continuous inferiorly with the spinal subarachnoid space. The interpeduncular cistern, which is also known as basal cistern, between the cerebral peduncles of the midbrain and the structures in the interpeduncular fossae, contains the cerebral artery circle. The chiasmatic cistern, the cistern of optic chiasm, inferior and anterior to optic chiasm, the point of crossing or decussation of optic nerve fibers. Quadrigeminal cisterns, cisterns of the great cerebral vein or superior vein. is in between the posterior part of the corpus callosum and the superior surface of the cerebellum. Take a look in your atlas, the right lateral and superior views of the surface of the brain. Also take a look at the subarachnoid spaces, ventricles, and subarachnoid system. For the secretion of cerebrospinal fluid, CSF is secreted by choroidal epithelial cells of the choroid plexus in the lateral, the third and fourth ventricles. 400 to 500 milliliters of CSF are secreted daily by the choroid plexus. The choroid plexus consists of vascular fringes of clear matter covered by cuboidal epithelial cells and are invaginated into the roofs of the third and fourth ventricles and on the floors of the bodies and inferior horns of the lateral ventricles. The circulation of cerebrospinal fluid, the CSF, leaves the lateral ventricle throughout the interventricular foramina and enters the third ventricle. From it, CSF passes throughout the cerebral aqueduct into the fourth ventricle. It leaves this ventricle throughout its median and lateral apertures and enters the subarachnoid space, which is continuous around the spinal cord and posteriorly over the cerebellum. However, most CSF flows into the interpeduncular and quadrigeminal cisterns. CSF from the various subarachnoid cisterns flows superiorly throughout the sulci and fissures on the medial and superolateral surface of the cerebral hemisphere. CSF also passes into the extensions of the subarachnoid space around the cranial nerves, the most important of which are those surrounding the optic nerves. The absorption of the cerebrospinal fluid. The main site of CSF absorption into the venous system is throughout the arachnoid granulations and tiny tube-like protrusions of arachnoid villi into the walls of the dural venous sinuses, especially the superior sagittal sinus and its lateral lacunae. The subarachnoid space containing CSF extends into the course of the arachnoid granulations. CSF enters the venous system throughout two routes. Most CSF enters the venous system by transport through the cells of the arachnoid granulations into the dural venous sinuses. Some CSF moves between the cells making up the arachnoid granulations. Approximately 330 and 380 milliliters of CSF enters the venous circulation each day. The functions of cerebrospinal fluid, along with the meninges and calvaria, CSF protects the brain by providing a cushion against blow to the head. The CSF in the subarachnoid space provides the buoyancy necessary for preventing the weight of the brain from compressing the cranial nerve roots and blood vessels against the internal surface of the skull. Because the brain is slightly heavier than the CSF, the gyri on the basal surface of the brain are in contact with the cranial fossa in the floor of the cranial cavity when a person is standing erect. In many spaces at the base of the brain, only the cranial meninges intervene between the brain and the cranial bones. In the erect position, the CSF is in the subarachnoid cisterns and sulci on the superior and lateral parts of the brain. Therefore, CSF and gyria normally separate the superior part of the brain from the calvaria. Small, rapidly recurring changes take place in intracranial pressure owing to the beating heart. Slow recurring changes result from unknown causes. Momentarily large changes in pressure occurs during coughing and straining and during changes in position. Any change in the volume of the intracranial contents, right? such as brain tumors, accumulation of ventricular fluid because of blockage of the cerebral aqueduct, or probably blood from a ruptured aneurysm, will be reflected by a change in intracranial pressure. This rule is called the Monroe-Healy doctrine, which states that the cranial cavity is like a closed, rigid box, and that a change in the quantity of intracranial blood can occur only throughout the displacement or replacement of CSF, right? The blood supply of the brain derives from the internal carotid and vertebral arteries. The internal carotid arteries arise in the neck from the common carotid arteries, ascend vertically to the base of the skull, and enters the cranial cavity throughout the carotid canals in the temporal bone. In addition to the carotid arteries, the carotid canals contain venous plexus and carotid plexus of sympathetic nerves. Within the carotid canal, the carotid arteries change direction, passing anteriorly and medially. They then run forward throughout the cavernous sinus, laying in the carotid groove on the side of the body of the sphenoid. The terminal branches of the internal carotid are the anterior and the middle cerebral arteries. Clinically, the internal carotid and the branches are often referred to as the anterior circulation of the brain. The anterior cerebral arteries are connected by the anterior communicating artery. Near their termination, the internal carotid arteries are joined to the posterior cerebral arteries by the posterior communicating arteries, completing the cerebral arteries circle around the interpeduncular foci. The deep depression on the inferior surface of the midbrain between the cerebral pedunculus. The vertebral arteries begin in the root of the neck at the first branches of the first part of the subclavian arteries. The two vertebral arteries are usually unequal in size, the left being larger than the right. The transversal part of the arteries pass through the transverse foramina of the first six cervical vertebrae. The suboccipital part of the vertebral arteries perforate the dura and arachnoid and pass throughout the foramen magnum. The vertebral arteries unite at the caudal border of the pons to form the basilar artery. The vertebrovascular artery system and its branches are often referred to clinically as the posterior circulation of the brain. The basilar artery is so named because of its close relationship to the base of the skull, ascends the clivus, the sloping surface from the dorsum sella to the foramen magnum throughout the pontine cistern to the superior border of the pons, and ends by dividing into the two posterior cerebral arteries. Each cerebral artery supplies a surface and pole of the brain. The arterial cerebral artery supplies most of the medial and superior surface of the brain and the frontal pole. The middle cerebral artery supplies the lateral surface of the brain and the temporal pole. The posterior cerebral artery supplies the inferior surface of the brain and the occipital pole. The cerebral artery circle, the cerebral arterial circle, is an important anastomosis at the base of the brain between the four arteries that supply the brain. The cerebral artery circle is formed by the posterior cerebral artery, by the posterior communicating arteries, the internal carotid arteries, the anterior cerebral arteries, the anterior communicating arteries. The various components of the cerebral arteries circle give numerous small branches to the brain. The venous drainage of the brain, the blood from superficial and deep veins of the brain enters the dural venous sinuses, which drain into the IG5 The cerebral vein on the superolateral surface of the brain drains into the superior sagittal sinus. The cerebral vein on the posterior inferior aspect drains into the straight transverse and superior petrosal sinuses, as do the superior cerebellar vein and transverse sinuses. Let us take a break, and we'll be back soon. 1, 2, 3.